Hey YouTube, it's Dr. Kristen Ray, family nurse practitioner, and this is Dr. Pace back with another. I'm sorry, go ahead.
I was just simply saying that I'm an OBGYN well baby nurse, nurse-free nurse, and doctor prepared as well.
We are back with another YouTube video, and something hot, fresh off the press is the pullback for Roe v. Wade. So as you may have already heard, the Supreme Court decided that they don't want to be bothered with these matters, and they're now going to leave this up to the state. So as healthcare providers, as women, as minority women, we want to share our take on this ruling.
So this is not research-based, this is strictly opinion, our thoughts, everything that our experiences even. So I'm gonna go ahead and put that as a disclaimer. This is not research-based, this is strictly our opinions, and we are all entitled to have one. And when it comes to this decision, as she said, it's left up to the states to decide how you want to govern, how they want to govern themselves. And so we kind of also want to talk about the implications that's going to cause as a result of this. I'll later get into being an OB nurse, what that means for us. First, I want to start off to say I am in Tennessee. Tennessee is part of the South, and the South is part of the Bible Belt. Is it below the Mason-Dixon line, or however they describe the Bible Belt, but it's the South, okay? Your Southern bills are here supposedly, and it's not that things don't happen here. The thing is, it happens behind the scenes. So we portray, because of the Bible Belt, portray this holier than thou life, but it'd be the biggest hypocrites, as you know, that be in the church. So not always, but they're there too. And so what does that mean for us in the South, in Tennessee, or some of our southern states, Mississippi? First, let's start off talking about the demographics of what's down here. We in the South, the Southeast region of the United States, we probably go as far up as, like, say, Kentucky-ish, the Carolinas, and then you come down to, like, your Kentucky, Tennessee, your Alabama, Mississippi, Georgia, and then supposed to be that Florida, Louisiana, all that little section right there. That's the Southeast region, where we are heavily populated with specifically African Americans. Now, as you know, this is going to impact all women. But statistically, now this is a statistic. Black women are 3 times as likely to die in childbirth or have morbidities in childbirth compared to our Caucasian counterparts. Now, there's a whole lot of reasons for that. And part of that is systemic racism and things that go along that line. But of course, we also have comorbidities that some of us choose to treat, or some of us, due to biases, both implicit and explicit biases from healthcare providers, we don't get treated for such things. How does this impact us? So I want us to go back in terms of the nursing world specifically, go back to Margaret Sanger. And Margaret Sanger is the founder, or was the founder, she's deceased, of Planned Parenthood. And Planned Parenthood, as you know, is only located in certain areas, or what the premise behind Planned Parenthood was to be located in certain areas, and certain demographics were to be impacted by it. And if you think about the same places where your liquor stores, your buy here, pay here's, your advanced financials, your, those kind of places, where are you going to find all those places at? Typically in the hood. And that's where you're going to find many, if not most, of your Planned Parenthoods. That was by design that she did that, because she saw back then that, her MO was originally to say that we want to make sure that we don't have these back alley abortions, and which meant that women who did not want these pregnancies were going into back alleys and doing things such as, this is graphic, but such as taking coat hangers and doing their own abortions. Well, as a result of that, the infection rate and people were dying as a result. Thus, the birth of Planned Parenthood. That sounds great, right? Right and wrong. So her mission in general was okay in terms of doing so, but when it's strategically placed in areas where it is populated by ethnic minorities, specifically Blacks, because she did not want to see the influx of brown people having, or Black people having, more babies, this is what happened. So when you have all that going on, in addition to now we have this reversal where the states are now back to making these decisions, it is not a federal thing anymore. What's going to be the implications for us in the South, specifically in the Bible Belt? What's going to be the implications for me as a OB nurse? I'm no longer bedside, but I do teach OB in my being a nurse educator. What's going to be the implications for people who couldn't afford to get abortions in the first place? What will be the implications for those who are assaulted, shall I say? I'm going to use assaulted to the point to where they get pregnant and it's unwanted. What about incest? Because that happens down here in the Appalachian Mountains and some of the other areas around these areas here in the South region, shall I say. So we're going to tackle a few of those things and kind of just talk about what our thoughts are, what's going to change as a result of, and then we'll kind of like to hear about what your thoughts are in the comments, and we will probably come back with a follow-up video at some point to discuss any new rulings, any new decisions by certain states about what they think or what's happened, and we'll probably have like a panel discussion about this topic. So that's kind of where we want to go with this topic.
Yeah, and to add to that, I would also say that there was something released saying that the overturning of Roe v. Wade had to do with part of it religion and things of that nature, which in my opinion, religion and politics don't mix. You have American citizens who their religion may not be Christianity, but the Constitution says equal, rights for all, but they, writing it and doing is two different things. But and now you're taking away women's rights to choose what to do with their bodies. And as a healthcare provider, I specialize in primary care, and I mostly serve lower social economical status patients who sometimes they utilize abortion services. So some of the things I'm anticipating seeing, in addition to unwanted pregnancies, I'm expecting to see a sharp increase in child abuse because now you have unwanted children. I'm anticipating seeing an increase in, as Dr. Pace said, mortality and morbidity in the pregnant women. I expect to see a increase in child abandonment. I expect to see an increase in unsafe deliveries. In addition, I mean, some states could even go as far as to make abortion illegal for things such as Dr. P said, rape, incest. I've even read where one southern state was saying that they were going to make an abortion for ectopic pregnancy illegal, and that is not a medically viable option. An ectopic pregnancy, if not terminated, can kill the mother and the baby. If the mother dies, the baby's going to die, and that the baby won't be anywhere near full term in order to survive outside of that. So I feel this is built upon ignorance and ego. It's certainly not backed by any sort of science or medical knowledge. And I also think there are some social determinants as to why this was overturned. And this came at a time where it's awfully coincidental. A few weeks ago, I read that the Supreme Court justices were awarded some additional Secret Service security for them and their immediate family. I can't imagine why. It did leak that they were considering overturning it. That got out and people were furious, and now it has officially been overturned. And I feel this is a topic that will affect all women, regardless of your beliefs and anything else. However, I do believe it will disproportionately affect women of color because we already have poor healthcare outcomes and healthcare disparities. And this is just one more strike against us. But women everywhere are going to be affected by this. Another thing that is going to happen, it's women that have means are going to be able to travel to states to get abortions if they, so choose. The patients that I serve typically, some of them don't have cars. They're living paycheck to paycheck if they have a paycheck at all, and won't have the means to utilize those kinds of services. So there's going to be a domino effect with this.
And also here, or not just here in Tennessee, but all states have what's called the safe haven law, where you can have a baby. The essence is complex, but the basis of it is, the gist of it is, you can have a baby and take the baby to a hospital, wherever, fire station, police station, certain locations that actually have, a lot of them have a safe haven sticker or something posted in their window, or something to say this is a safe place to bring your baby, no questions asked. Okay. And you can do that. Do you anticipate, or can we anticipate, this is a rhetorical kind of question, but can we anticipate that if people are forced to have babies that they don't want, that number may go up? This is just me thinking out loud. This is not something that I've seen or researched or whatever. We won't know until this is in full effect, and it depends on what state does what. So that's something else to consider. The numbers of unwanted pregnancies or unwanted children, people who do have the child, or that, so they're going to drop these babies off where, and they become wards of the state. Okay, so let's kind of follow this through. They become wards of the state, which means they have to go into the foster care system, right? Which means we have to find families for them, right? Which means we have to pay families, because foster care, they get paid to take care of other people's children or to adopt. Foster care and then adoption, if that's a plausible thing. Think about the mental health of the child. I mean, this is multifaceted. Well, you want to know where you came from. Why my mama get rid of me? What's my history? Who's my family ties? Then you have to deal with the traumas that go on, and the abuse that goes on even in the foster care system sometimes. So the problems with this is not even just about conception, or the delivery of the baby. It's beyond that, even with the safe haven law, and that's not 100% that's going to happen every single time, but we know we already have mental health issues and trauma here in the US and abroad anyway. So then we bring this notion into it. What do you think can happen as a result of that? So that's one thing we need to think about. In my, OB world, like I said, okay, let's just say, for instance, people who have tried multiple ways, the poor people have tried multiple ways to end these pregnancies. They're depressed. A lot of times when we're depressed, we do things we should not be doing. Alcohol, drugs, eating. We always eat. A lot of us eat bad when we're pregnant anyway. That's nothing. We eating for two, so I'm gonna eat 20 donuts, something crazy like that. But that's the least of our problems, your diet, when it comes to the implications that can cause when you are doing other things such as drugs, alcohol, both, and/or doing activities that put you at risk. You see what I'm saying? So what does that, and then you may say, some of y'all may say, you know what, well, I'm 50, I'm done having kids or whatever it happens to be. Okay, but if you have any children, your daughter, and okay, you're 50. Well, a lot of us 50, well, no, not everybody, because I'm about to say, by 50 you're in menopause. Not everybody. I know some people who 55, 60 years old still taking birth control. So because that change hadn't occurred yet, right? Which means what? You can still get pregnant at 50 something years old if you have not reached menopause. So imagine, okay, you have a situation where you're 50 years old, you're like, my baby 30. My youngest child, 30 years old, I'm living my life. And then you're pregnant. You decide, okay, do I really want to have a child? And I'm not arguing one way or the other, to each their own on this. It's your body. You figure what you want to do with your body. And I'm not encouraging somebody to have a baby or not have a baby, but I'm just simply saying, I'm throwing it out there. You're 50 years old, 55 years old, you can still get pregnant because you haven't reached menopause yet. And you do that. You having a good time with your wife. Nothing wrong with that. Adults do what they do. And you get pregnant. Then what? What is it going to be to her? And again, I'm playing devil's advocate, so this is not which side I'm on. Your child gonna be, you 55, by the time your child is an adult, let's just say 20 or 18, you're gonna be 73. And that child has to take care of you when you're into your older age, and they only a teenager themselves, they're babies still themselves. Anyway, what is your choice? Or, you say, well, I'm done having kids or whatever. Okay, that doesn't mean, Lord forbid, that something doesn't happen to you where you are assaulted in that way. And as you know, if you are still, able to have children, you can get pregnant that way. This is not an unheard of phenomena, so what happens in those situations? That's just something for us to think about the implications of how it can be for this said population. And that does impact all women. If you got a uterus and you are of childbearing age and you have no other issues, you can become pregnant, you know, intentional, unintentional. Some, we know, a lot of us know a lot about that. Or then you could have been abused in a way. And I don't say that word because I don't want us to get, you know, flagged or whatever, but you could be SA'd and then end up with the results of an unwanted pregnancy. Or like you said, the ectopic, okay, not viable. They immediately go in. The only way to save you, besides the pain and everything bursting in terms of your ovaries and everything, is to go ahead and, you know, remove the tube.
Mm-hmm.
That's how we keep you alive. And there's nothing wrong with that. What about, okay, here's another one. What about when you discover, and this is real life. I had a patient, actually she's a coworker of mine. What about if you discover you're pregnant, you wanted the baby, right? But you discover the baby has anencephaly. And anencephaly, the basis of it is, I mean, I'm not gonna get into the whole pathway behind it, but basically they don't have a brain. Is that the gist?
Mm-hmm.
The features of the brain and is not developed. So as you know, you can't function without a brain. They're not viable. They're not even compatible with life. And so in those situations, people can make the decision, you know, and typically, we don't even do, for a normal pregnancy, we don't even do ultrasounds till you're about the 20 weeks. The anatomy ultrasound, anatomical ultrasound is done at 20 weeks, halfway through your pregnancy.
Mm-hmm.
High risk people like me, I get mine done early because I've always had complications with my pregnancy. So I would catch something like that, you know, probably by week 8, if I know about that I'm pregnant. But the people who are, you know, nulliparous, or nulla gravida, sorry, not nulla gravida, which means this is their first pregnancy, or they have been having healthy pregnancies where they only get that one ultrasound. You 20 weeks in, what about then? So the baby has anencephaly. It's not compatible with life. Born at 25 weeks, 30 weeks, it's still not compatible with life. Do they have that option? Depends on what state they live in. So these are just things to think about. Those are kind of my thoughts.
I agree. And where you live should not be a driving factor in what you can do with your body. I mean, just that very premise is disgusting. Also, I feel that this is more about control of the population than it is about anything else. You figure, you know, some populations have limited access to healthcare as it is. So now you're taking away another service for people. If this wasn't about that sort of control, I think they could have done so many other things, like make healthcare more accessible to people, make healthcare more affordable.
Mm-hmm.
You could do birth control over the counter, make birth control pills be over the counter, not something you have to necessarily go in to see a provider for. If you were really concerned about women use, for example, women using abortions as a form of birth control because they don't have access to other things. You have a whole bunch of other vaccines at the pharmacy. Throw some depot in there. You can go to your CVS and get your depot every 3 months. You can make birth control more accessible, because that was another argument that some people are using abortions as a form of birth control. And again, that's your body. You do what you want. But if that is truly an issue, there's so many other things you could have done. This country has a long history of taking away rights of people. This is no different, and we're in 2022. And the fact that they went and did that shows you that they don't care. They don't care, and they're going to do what they want to do, regardless of who likes it and who doesn't. So with that, I say, again, that I think that the minority population is definitely going to be disproportionately affected. We already have so many barriers to our healthcare, and now you're adding this on top of it.
So we kind of want to wrap this video up. This was not meant to be, you know, intensive, just sharing some thoughts. This is just hot off the press. It just came out. You are watching this, or this video was recorded in June of 2022. And, you know, this happened a few days ago, or yesterday, actually. And so we wanted to kind of just shed some light. We will definitely be revisiting this topic at some point in time and kind of discussing what the latest happens to be when it comes to this issue and other issues. So, you know, just to kind of pull this whole thing together, you will find that we're going to discuss nursing issues that are current and kind of give our take on it, our opinion on it. We're going to have not research, but we're going to have panel discussions regarding this topic and other noteworthy topics as well that is a current issue or trend in healthcare, and talk about how it impacts not only the BIPOC community, but just women as a whole, or our community as a whole. And so we would love for you to be part of the discussion, especially in the comment section, and kind of engage in the comments and let us know, what do you think about this decision, Roe v. Wade, and that the states will make their own decisions about who should and who should not. We want you to weigh in, and we'll come back with another follow-up video and, you know, discuss, you know, our updated thoughts as things begin to unfold as time goes on. So as usual, if you enjoy this content and you want to see more of this content, I need you to do a few things for us. We need you to subscribe. That little button right there is free. Subscribe. Free 99. Best price ever. It's free. Subscribe. If you also don't mind, like, comment. The dialogue, the engagement is what we love. We love engagement. So definitely engage with us and tell us your thoughts on this and other subjects. If there's anything else that you want to see in terms of content-wise that you want us to make a video on, our thoughts or whatever it happens to be, comment that below as well. In addition to that, we want to ask you to join us on our other social media platforms, on TikTok as well as on IG. TikTok, you will see short clippings of whatever these and other issues, but this is where you get the expanded version on YouTube as well, you know, and then of course the snippet version on TikTok and how we engage with our audience over there. So definitely join us. Both handles are the same, so it's at Nursing Dynamics. We want you to go ahead and also watch the other videos that we have posted that you will enjoy. You will see some shorts, some case studies. You will see, again, topics like these, our personal struggles in nursing school, and the list goes on and on and on. And we also want to, one more thing we want to add to, totally unrelated to this topic, but if you happen to want to know, if you're a nursing student and want to know, you know, or not even a nursing student really, but you want to know things that we're using for our skincare regimen, or we've been asked that question before, or, you know, if you're a nursing student, want to know what books should you pick for school or NCLEX or whatever it happens to be, we have a little icon up there from Amazon storefront that we have, Nursing Dynamics, of course. And we have vetted these items and products to say, you know what, these work for us. Now, skincare, we can't guarantee, you know, skincare works different on different people. So, but this is the things that we use for our skincare regimen. Also, you know, NCLEX books and things like that that you can use to help get you through your nursing school journey. So that is it for now. Thank you all for watching this video to the end. If you're still here, we appreciate you. Also watch other videos. Tell people about our content at Nursing Dynamics. Here on all the platforms are the same, on YouTube, on IG, and on TikTok. Definitely follow us everywhere, because we have great things coming and we'd love for you to join us on our journey. Until the next time, you all take care. Bye-bye.